ask the question, what is the power supply to the macula? Well, it's the stomach circuit in almost all cases. So you go measure the stomach circuit, and you'll find it has low voltage every time. So then you have to ask the question, well, why is the voltage low in the stomach circuit? Which explains why you don't have the ability to make new cells to keep the macula healthy. Well, it's usually a combination of things. Most people who have macular degeneration are hypothyroid, but it's usually undiagnosed. There are many reasons that hypothyroidism goes undiagnosed, but the main one is that doctors are trained to look at the test called TSH, and it's a very unreliable test. In addition, in 2003, the American Academy of Clinical Endocrinology said that it should be 0.3 to 2.0. But still, each day when I get a lab report in and I measure the TSH, it says that anything that's below 4.6 is okay. So the lab tests are 10 years late updating their normals. So for example, if your test comes back 4.0, your doctor will tell you your thyroid's fine, but it's not fine. 4.0 is twice the 2.0 that it should be. And then there's another problem with thyroid care, and that is that the active form of thyroid hormone is T3 at the cell membrane and T2 at the mitochondria. But doctors either measure TSH by itself or TSH and T4, but T4 has to be converted to T3. And to convert from T4 to T3 requires iodine, selenium, zinc, progesterone, cortisol, glutathione, and vitamin C. And if you're deficient in one of those, instead of making T3, you make a fake hormone called reverse T3. Well, doctors almost never measure those things. And so you can have a completely normal TSH, even with the updated normals, and still be 80% deficient at the cell membrane level. So unless you measure T3 and reverse T3, you don't really know what's going on with the thyroid. And what you'll find is that most people who have hypothyroidism or have macular degeneration are hypothyroid. The other thing is that I mentioned that dental infections put out such severe toxins that they take down the acupuncture voltage. So it turns out that, as I mentioned, the power supply to the macula is primarily the spleen stomach circuit. And the teeth that are on that circuit are upper molars and lower premolars. And so if you measure those teeth carefully, you will almost always find that there's decay either under a filling or a crown, or worst of all, they have a root canal in one of those 8 teeth. Then that's going to take down the circuit and contribute significantly to their macular degeneration. And usually, if you find a tooth that's down, that is infected. If you go down and follow that circuit all the way to the foot, you'll find there's a scar across that circuit. So what commonly happens is that somebody falls off their bicycle when they're 6 and they get a scar across that circuit, which grounds it out and reduces its voltage. And since each tooth contains a pump that pumps fluid from inside the tooth to inside the mouth to prevent it from getting infected, it drops the voltage enough that that tooth tends to get decay. So you get a filling. That filling lasts, on average, 7 years, and then there's infection under it, so you get another filling that's bigger, and then another 7 years to 10 years goes by, and you get another filling that's bigger, and then eventually your tooth breaks off and you get a crown, and that lasts a few years, and then you get another crown. And so by this time, you are approaching the age in which we began to see macular degeneration, which, by the way, is harder to define. Through the early part of my career, you never saw macular degeneration except from people that were, say, 65 and older. But by the end of my career in ophthalmology, we were starting to see macular degeneration in people down in their 40s. And of course, now we understand why, because they were having all of this dental work done, and with the addition of fluoride into our food supply and into our water supply and into our dental toothpaste, etc., people became more and more hypothyroid because fluoride shuts down thyroid function. And so for all these reasons, we began to see younger and younger people having macular degeneration. And of course, the other thing that happened is that to make nitric oxide, you have to have stomach acid that works, and people became more and more deficient in iodine, zinc, etc. And you have to eat green leafy vegetables. And there are so many people that the only green leafy vegetable they ever eat is lettuce on a cheeseburger. And of course, the lettuce has the nutritional complement of eating newspaper. So the point is that you have all of these various functions going on that are keeping you from making new macular cells. And one has to address them all. So what we did was that we've figured out a way. First of all, one of the things that I did when I was responsible for all of the scanner training in the US is that over time I felt like I had figured out different frequency sets that would work even more efficiently than the Russian frequency set, and eventually put them into a device that I call the biomodulator. And indeed, it turns out that most people who have both units have found that the biomodulator frequency sets are indeed more efficient. Secondly, what I found was that the best way to deliver them to the macula was through a magnetic field. So we developed a device that plugs into the biomodulator called the biotransducer. The electronics in it create a specific magnetic field with specific frequencies, and then it sends out this magnetic field along with photons from a specific light source. And then we modulate the frequencies from the biomodulator onto that, so the person holds it up to their eye like this, and that puts the magnetic field and puts electrons directly into the macula at the appropriate frequency so that the energy is transferred. So we take care of